Brooklands Radio believes your health matters.
In the studio with me today, I've got Idili Kamaturu. Good afternoon.
Good afternoon.
Idili.
Thank you for having me.
I'm just making sure I pronounce your name right now.
Yes, that's correct.
That's fantastic. Well, it's lovely to have you here today.
Thank you.
Idili is a cognitive behavioural therapist, and we know that April is National Stress Awareness Month. So new research released earlier this month revealed that 73% of under 35s in Surrey have experienced stress, and 54% have suffered poor sleep as a result of worry or stress. The research was commissioned for Stress Awareness Month in April and highlights the need for greater support for those who are living with the damaging impact of stress. Idili, why do you think so many people are impacted by stress today?
I feel that stress has always been experienced by people, but maybe in the past they weren't able to identify it in themselves or talk about it as much as now. So this feeling might be experienced more frequently nowadays because we have a fast-paced life where lots of changes are taking place. So this can create a feeling of uncertainty or unpredictability in the future, which of course enhances stress. So in order for our bodies to both physically and mentally adjust to these changes, a low level of stress that lasts for a short period of time can be helpful actually, because it makes us alert and able to actually do things differently and adapt to change. But if that stress lasts for longer, that's when problems can be created. It's quite ironic actually, but sometimes our own assumptions and beliefs can make stress linger for longer.
Yes.
And it's interesting because stress is not just caused by what we consider negative events like being made redundant or experiencing relationship problems, but it can also be caused by positive changes like getting a promotion at work or having a child. It's actually interesting that marriage and retirement, which are parts of most people's lives, are in the top 10 of stressful life events.
It's funny, isn't it? I think in the past, you would get a newspaper in the morning and you might read it, but you wouldn't have that news and updates on that news blasted to you all day. So I think that the great thing about today is that you can find out anything like that. But that's also bad as well. Because things that we probably never would have worried about before, like what's going on with, dare I mention the B word, you know, with Brexit, we wouldn't have thought about it because we'd have only got short updates every morning. But now we're hearing everything as it goes along.
Absolutely.
And I think anything like that can make you worry a little bit if you're prone to worry.
I think our focus is always directed to the negative stuff in life, which of course makes stress worse.
Why do you think it is that so many people find it hard then to talk about mental health?
That's interesting, isn't it? Because a lot of the time we might feel comfortable sharing information about physical health conditions we might be diagnosed with, but when it comes to mental health, we really struggle to open up even to people that we trust, like family and friends. Unfortunately, there's still a lot of shame and stigma attached to mental health, and when I work with people, I find that the main reasons are fear of being judged and also a sense of failure. So a lot of people think that asking for help means that I have failed, or not being able to control my feelings is a sign of weakness. And unfortunately, some people still have some false beliefs that if I access support for mental health, people might think that I'm not able to care for my children or my career might be destroyed. And this keeps people quite isolated. They even deny that stress is present in their lives because of these reasons, and they tend to put a brave face on when they interact with others in order to hide their symptoms.
Yeah, it's sad really that people can't, because talking about it's half the battle, isn't it? If you can talk about it,
it's
you'll
the first step, definitely. Yeah.
Right. What's CBT?
CBT stands for Cognitive Behavioral Therapy, and the way that basically it helps people is that it helps them target difficult feelings by helping them identify and alter thinking patterns that can be unhelpful, and also behavioral habits that might make the problem worse. So the first part of therapy is usually identifying these maintaining cycles of difficult feelings, and then as a next step, talking about strategies and techniques of managing these feelings better. So it's very much a collaborative work between the therapist and the patient, and the aim of CBT is to make people very independent and their own therapists, really able to use these techniques even after the end of therapy.
Okay, now that all sounds good. What would happen during a typical online session?
So after we arrange a convenient time for the person, we would see people for either 60 or 30-minute sessions. Mm-hmm. So the first session can either be an assessment, if people haven't already been assessed, where we look at people's symptoms and their goals for therapy, or it can be a first therapy session. Mm-hmm. So the structure of the session, usually we would start by looking at the previous session, review any tasks that the person completed during the week, and we would also reflect on people's scores on anxiety and depression questionnaires. Then the main body of the session would be decided in a collaborative way, and it would be in line with people's goals. So we might focus on worry management or sleep hygiene, and we will close the session by setting tasks for the following week and also asking for feedback.
Okay, that sounds good. So, and what are the benefits of receiving CBT, especially therapy online?
It's very easily accessible, so people just need a laptop or a mobile phone and access to the internet to be able to use this support. It's ideal for people who lead busy lifestyles or who might find it hard to leave the house because of childcare issues or physical health conditions. So there's no need of money, energy or time spent traveling to sessions. And also some people find it easier to open up and be honest about their feelings when they are in an environment that they feel safe, or in other words, from the comfort of their own home.
Yeah, and with someone that they don't know, someone from outside their immediate circle. Okay. Idili, how long have you been a therapist? Tell us a little bit more about you.
My background is in psychology, counseling and mental health, and I specialize in cognitive behavioral therapy at the University of Oxford. I've been working in the NHS for the last 8 years, and I started by working in acute mental health services. So I worked in a general psychiatric ward, and then I moved into community services, working with people with psychotic and non-psychotic conditions. And in the last 3 years, I've been working in an IAPT service for people with mild to moderate anxiety and depression. I'm working for ISO, and I also have my private practice where I provide CBT sessions, but also training and workshops.
Ah, so very, very experienced. Okay. And thank you. Thank you very fantastic. Much. Thank you for talking to us today. So that was Idili Kamataru talking to us today about this new service.
Brooklands Radio believes your health matters.